Hi, I'm Dr. Prashant. I'm Psychiatrist and Sexual Wellness Expert. I'm co-founder and director at PassionFruit Wellness, Bengaluru and Pune.
So when the client they reach out us, so many times we have seen that they take different medicines over the counter. Certain medications are available over the counter. For example, it is Sildenafil and the next advanced molecule is Tadalafil. So many patients before reaching out to doctors, they tell us that doctor, I have tried Tadalafil, I have tried Sildenafil. So now let's understand what these medicines are. So what is Tadalafil? So Sildenafil and Tadalafil mainly prescribed, actually it has to be prescribed by the doctors to treat the erectile dysfunction, right? Also the Tadalafil and Sildenafil are used certain other medical conditions like in lung condition, which is also named as pulmonary hypertension. So overall the Sildenafil and Tadalafil are prescribed to treat the sexual dysfunctions like erectile dysfunction and the pulmonary hypertension. Now this Tadalafil and Sildenafil and few more newer molecules, they comes under the group called as PDE5 inhibitors, right? So I don't want to discuss the mechanism of this, but overall just brief information I will give you about the Tadalafil and Sildenafil. So when should this medication one can take? So because these two medicines, they have different half-lives. Half-life means once you take the tablet, the start of action is different for Sildenafil, the start of action is different for Tadalafil. Now Tadalafil has a longer half-life. Again, I don't want to use medical terminologies here, but in layman's language, it means Tadalafil has long half-life means it works for longer duration. It may work for 36 hours also. Once you take the tablet, it may work for next 36 hours. So you can have sex today, you can have sex tomorrow also. That's why it is commonly or very famously called as weekend pills. Means once Friday comes, so you take that pill, so that works for Saturday and Sundays. That's why it is called as weekend pill. So that is the duration of action. If we talk about the Sildenafil has a half-life, very short half-life, maybe 1 to 4 hours. So that is been advised to take only 1 hour before sex because of short half-life. Since Tadalafil has longer half-life and it works for 36 hours, so usually I tell my clients, you take this medication 5 to 6 hours before, not just 1 hour before, it may not work for you. So that is the difference between Tadalafil and Sildenafil, the duration of action. Now if we talk about the when to take, means timing I told you, but if we talk about before food, after food, because that is a very common question asked by the patient, doctor, should I take this before food or should I take this after food? So to answer your question, Sildenafil interacts with food. So if you take a fat rich food, it may not work. So it is ideally should be taken without food or less fat content food. On the other hand, Tadalafil fortunately doesn't interact with the food. So it can be taken before food or even after food. So that is one advantage of Tadalafil over the Sildenafil. Now if we talk about the side effect profile, since it is the same family, more or less the side effect profile is same for both the molecules like Sildenafil and Tadalafil, but however few side effects are more common in Sildenafil versus Tadalafil. The person may suffer like blood vision, back pain, lower leg pain. These are very commonly experienced side effects. Someone is taking Sildenafil versus someone is taking Tadalafil. The headache is more common in people taking Tadalafil more versus Sildenafil. The blurring of vision is less in Tadalafil and more in Sildenafil. So plus or minus both comes under the same family, but doctor will choose which medicine is suitable for you. So it is very sincere advice from me. Don't use your own decision. I should take Sildenafil, I should take Tadalafil for your or for your issues or to improve your sexual function. Now when one should not take this? Again, as such there are no such contraindications. However, someone is taking nitrates because that the medicine interacts with the nitrates and suddenly the blood pressure goes down, hypotension, the person should not take. Someone underwent any cardiac surgery, angioplasty or any bypass surgery, so within 6 months preferably not to take this medication. So once you are stable, adjusted, please meet doctor. Doctor will assess you, evaluate you, some basic investigations are required, some basic questions are important for you, and once doctor feels that yes, you can take Tadalafil, even we prescribe Tadalafil if someone underwent bypass surgery or even the angioplasty. However, there are certain criteria which only doctor knows, and then the doctor will prescribe the medication, and please follow the doctor's instruction. So as no contraindication, but these are the situations where one should avoid taking Sildenafil or Tadalafil. Many of my clients, they ask, doctor, once I start Tadalafil, how long I should continue, or how long it is safe to take this tablet. So ideally, these medications, as I said, very safe to take. However, under medical supervision, you don't decide that I will take 3 months, I will take 6 months, I will take 1 year. No, that is not recommended. It is safe to take with the dosage decided by doctor, however under medical supervision. So obviously don't take without the prescription, that is one thing. Secondly, there is research says that Tadalafil will not cause dependency, right? Some people, they may get psychological dependency if someone is taking for a very long duration, because later that psychological dependency or that the thought process, if I take medicines then only I can perform. So that dependency may develop, but if it is taken under proper medical supervision and proper instructions, definitely these medicines are very safe even to take for longer duration.